What if I told you that one of the most dangerous mistakes older adults make with blood pressure is not ignoring it, but chasing the wrong number? I have seen people in their 70s feel frightened because they were not hitting a target that sounded ideal on paper, while their body was quietly telling a different story through dizziness, fatigue, unsteadiness, brain fog, even near falls. And I have seen others told, "Your pressure is fine for your age," when in reality it was. Staying high enough to strain the brain, kidneys, heart, and eyes every single day. So yes, blood pressure matters, but the target has to make sense for the body you have at 70, not the body someone had at 40. I'm Dr. Thomas Reynolds, and if you're over 60, especially over 70, this conversation matters more than most people realize, because blood pressure is not just a number on a cuff. It is pressure inside the pipes that feed your brain, support your kidneys, protect your balance, and keep your heart from wearing out too soon. In this video, I'm going to explain what a realistic blood pressure target often looks like at 70, why the old one-size-fits-all advice can be misleading, why some people actually feel worse when the pressure is pushed too low, and how to think about your numbers in a way that protects both your health and your independence. And let me give you the answer early, because I don't want you waiting for it. For many healthy, active adults around age 70, the goal is often somewhere around the low 130 seconds systolic, and in many cases below 130/80 if it is well tolerated. And this is the part too many people skip that is not the whole story. If you are frail, dizzy when standing, falling, losing weight, living with multiple illnesses, or taking several medications, the right target may be less aggressive. In many older adults, a systolic pressure in the 130s, rather than pushing hard into the 110s or low 120 seconds, may be the safer and smarter place to live, not because lower is bad, but because tolerance matters. That is the real message today. At 70, your blood pressure target is not just about reducing risk on paper. It is about protecting the organs that matter while preserving how you actually function in daily life. If you're watching and you check your pressure at home, let me know in the comments what your usual top number is. I always find it helpful to see how many older adults are actively paying attention and learning how their body really behaves outside the doctor's office. The first truth you need to understand is this. Blood pressure changes with age because the arteries change with age. When you are younger, arteries are more flexible. They expand and cushion each heartbeat. But after 60, 70, and beyond, those blood vessels often become stiffer. Think of a new garden hose versus one that has been left in the sun for years. The newer hose flexes. The older one resists. That means each heartbeat creates more pressure against the vessel wall. This is one reason the top number, the systolic pressure, often rises as people get older. What many people misunderstand is that a higher top number is common with age, but common does not mean harmless. High systolic pressure is strongly associated with stroke, heart failure, kidney problems, and decline in memory and thinking. So if someone tells you, don't worry, everybody's pressure goes up at 70, that is only half true. Yes, it happens often, but no, it should not be ignored. At the same time, the bottom number, the diastolic pressure, may not rise in the same way. In some older adults, it stays steady or even falls. So you may end up with a wide gap between the top and bottom numbers. That wide gap can be another clue that the arteries are becoming stiff. And stiff arteries are not just an age badge. They change how blood flows to the brain, the heart muscle, and the kidneys. So already you can see the problem. A blood pressure goal at 70 cannot be based only on a generic chart. It has to account for the biology of aging. The second truth is the one most of you came here for. At 70, the best target is usually a zone, not a trophy that matters. Because many people treat blood pressure like golf. The lower the score, the better. But medicine is not that simplistic. In many current approaches to blood pressure care, especially for generally healthy older adults living independently, a target below 130/80 is often recommended if it can be achieved safely and tolerated well. That may help reduce the risk of stroke, heart disease, kidney damage, and even cognitive decline. But if tolerated, doing a lot of work in that sentence. Because if your number looks beautiful on a sheet of paper, but you feel dizzy, washed out, or mentally slower, that target may not be beautiful for you. In older adults, especially after 70, we do not treat numbers in isolation. We treat people. We treat the brain. That needs steady blood flow. The kidneys that still have to filter, the legs that need enough pressure to help you stand, walk, and not collapse in the kitchen or bathroom. So what does this mean in plain English? It means that for many robust, community-dwelling 70-year-olds, a systolic blood pressure in the 120s to low 130 seconds may be a very reasonable goal. But for others, especially those with frailty, orthostatic symptoms, advanced vascular disease, or a history of falls, a systolic pressure in the 130 to 139. Range may be more realistic and safer than forcing it lower. That is not giving up. That is individualizing care. And if you are over 80 or dealing with multiple medical problems, the conversation often becomes even more personalized. The target has to fit the life, not just the guideline. The third truth is one of the most important, and it is the one I wish older adults were warned about. The standing blood pressure matters almost as much as the seated one. I can't tell you how many times I have seen a patient reading that looked acceptable, only to have them stand up and suddenly feel lightheaded, unstable, or weak. That drop in pressure when you stand is called orthostatic hypotension. That sounds technical, but it simply means the body is not adjusting pressure quickly. Enough when posture changes. Why does this matter at 70? Because this is the age when people start saying things like, "I'm fine once I get going, but when I first stand up, I feel a little off," or "I almost blacked out in the bathroom," or "I don't know why I'm so unsteady first thing in the morning." Sometimes that is dehydration, sometimes medication, sometimes nervous system changes, sometimes overtreated blood pressure. Here is the danger. If all anyone looks at is the seated number, you can miss the whole story. The brain is like a high priority room in the house. It needs constant delivery. If the pressure drops too much when you stand, that room doesn't get what it needs in that moment. The result may be dizziness, blurred vision, confusion, or a fall. And for older adults, falls are not a side issue. They can change a life overnight. So if you're being treated for blood pressure and you've had dizziness, near fainting, sudden fatigue when standing, or unexplained falls, tell your physician, ask for seated and standing measurements. That simple step can completely change how treatment is adjusted. The fourth truth is that home readings often matter more than the single number taken in the clinic. This is a big one. Many older adults become anxious because they get one high reading in a medical office that happens all the time. Stress, pain, rushing, a full bladder, bad cuff technique, talking during the reading, these things can all drive it up. On the other hand, some people look fine in clinic and run high at home for other 23 hours of the day. That is why a home blood pressure average is often far more useful than one isolated reading. Think of it this way. One office reading is a snapshot. A week of home readings is a movie. And when you are making decisions about treatment at 70, you want the movie, not the snapshot. Here is the simplest method. Use a validated upper arm cuff. Sit quietly for 5 minutes, feet flat, back supported, arm at heart level. No talking. Take 2 readings, 1 minute apart. Do this morning and evening for several days, unless your doctor has told you a different schedule. Then look at the average, not the worst single number that frightened you. This matters because the right target at 70 should be based on your usual pattern, not one stressful moment. And yes, if your readings are repeatedly very high, that deserves attention. But if you are chasing every isolated spike, you may end up over-medicated. The fifth truth is surprisingly overlooked. Numbers do not live. Alone, kidney function, memory, and medications all belong in the same conversation. This is where truly good blood pressure care becomes more human. If you are 70 and active, walking, thinking clearly, sleeping well, and your home pressure is sitting in a safe range without dizziness, Wonderful, but if you are 70 and taking 4 or 5 blood pressure medications, feeling drained, urinating constantly at night, cramping, dizzy, and afraid of falling, then the question is no longer just, did we hit the target? The question becomes, what did it cost to get there? Some medications can lower blood pressure beautifully but leave a person tired or dehydrated. Some can affect sodium or potassium. Some can worsen swelling. Some can change nighttime bathroom trips, which then affects sleep, which affects balance, memory, mood, and blood sugar. In older adults, everything is connected. The kidneys are especially important here. They are like the body's filters. Too much pressure can damage them over time. But pressure that is pushed too low in the wrong person can also reduce perfusion, meaning blood flow through those filters may not be what it needs to be. The goal is balance. The brain matters too. Chronic high blood pressure is associated with stroke and vascular damage that may affect memory and over-aggressive lowering in a vulnerable older adult can sometimes leave them feeling foggy or weak. That is why the best blood pressure target is not only evidence-aware, it is body-aware. If you're finding this helpful, take a moment to like the video and subscribe. The reason I say that here is simple. Older adults deserve health guidance that is not rushed, and not based on treating them like lab values instead of human beings. The sixth truth is this: the top number is not the only number that matters. Most older adults focus on systolic pressure, the top number, and for good reason. It is especially important with aging arteries. But I also pay attention to the bottom number, the diastolic pressure, and to the gap between the two. That gap is called pulse. Pressure. If your reading is 138/78, that is one picture. If it is 138/58, that is another, same top number, very different physiology. Why? Because the heart itself receives much of its blood flow during the resting phase between beats, when the diastolic pressure matters. If that bottom number falls too low in some older adults, especially those with coronary disease or significant stiffness in the arteries, it can become a concern. It can become a concern, but not always. So sometimes. We talk about what it should be at 70. Please remember, this is not only about getting the top number down, it is about bringing pressure into a healthy range without starving the system of the pressure it still needs. That is another reason you should never change medication based on one video or one online chart. Your heart history matters, your kidney function matters, your kidney function matters, blood pressure matters, your symptoms matter, your symptoms matter, and now let me give you the most practical answer of all. If you are around 70 and generally healthy, mobile, and living independently, many clinicians will often aim for a blood pressure somewhere below 130/80 if you tolerate it well. If getting there causes dizziness, frequent falls, confusion, or makes your standing pressure unstable, then the target stable. Then the need to be softened in many older adults, especially those with frailty or complex illness. Blood pressure in the 130s may be more appropriate than pushing lower. What we usually want to avoid is leaving the pressure consistently high, especially in the 140s, 150 seconds, and beyond without a good reason, because that increases long-term risk to the brain, heart, and kidneys. That is the middle path. Not too high, low enough to protect, low enough to function, high enough to function. And there is one more thing I never want you to ignore. If your blood pressure is repeatedly above 180/120, or if you have chest pain, shortness of breath, severe headache, weakness on one side, trouble speaking, or sudden vision changes, that is not a watch and wait moment that needs urgent medical attention. So where does all this leave you tonight? It leaves you with a better question. Not what number did my neighbor get? Not what target did some chart assign to everyone? Not even how low can I push this? But what blood pressure range protects my brain, heart, kidneys, and balance while still allowing me to live well? That is the question of healthy aging. Success is not measured only in millimeters of mercury. It is measured in how steady you feel when you get out of bed, How clearly you think in the morning, whether you can walk with confidence, whether your kidneys stay stable, whether your medications are helping more than they are hurting, whether you can protect yourself from stroke without losing your strength in the process. That is why this topic matters so deeply, because blood pressure is not just about living longer. It is about living clearer, steadier, and more independently. I'm Dr. Thomas Reynolds, and if I could leave you with one message, it would be this. Your blood pressure target at 70 should not be borrowed blindly from a younger body or from a one-size-fits-all chart. It should be individualized, monitored carefully, and chosen with wisdom. For many healthy older adults, the goal is often in the low 130 seconds or below 130 over 80 if tolerated. For others, especially if frailty, dizziness, falls, or multiple illnesses are part of the picture, the right target may be a little higher. The best number is the one that protects your future without stealing your present. If this video helped you, tell me in the comments, what is your usual blood pressure? And do you ever feel dizzy when standing? And if you want more calm, practical guidance for healthy aging, subscribe and stay with us. Because small, informed adjustments still matter. And at 70, they may matter more than ever.